Good afternoon. My name is Carlos Sanchez. I'm Public Affairs Director for Hidalgo County. I wanted to begin by apologizing for any confusion. We initially had planned a 3 p.m. conference call, but as you'll shortly see, we thought it more appropriate to have a press conference. So with that, I'd like to introduce County Judge Richard F. Cortez.
Good afternoon, everyone. After consulting with the leadership of 22 municipalities here in Hidalgo County, I have decided to issue a disaster declaration due to the public health emergency we're experiencing now. This declaration will be effective Tuesday morning and will remain in effect for 7 days. I will be asking the Hidalgo County Commissioners Court to extend this order an additional 7 days until March 31st. As part of this declaration, I am prohibiting mass gatherings in Hidalgo County of 50 people or more. In addition, we have been in constant contact over the last several weeks with local educational institutions. They have been amenable to our recommendations to follow the CDC guidelines. Businesses are also voluntarily changing their operations to comply with the CDC recommendations and avoid having more than 50 people at a time for the facilities is important. This has not been an easy decision. I recognize the hardships that this declaration may have on many of our citizens. I make this decision for the greater good of the county. In conferring with city leaders in Hidalgo County, we have reached a consensus that this is a necessary step to mitigate what we believe is inevitable, that someone in Hidalgo County will test positive for the COVID-19. I appreciate the level of support the city leadership has displayed, and I fully expect that each of the 22 municipalities will be issuing similar declarations in their respective jurisdictions. Residents of Hidalgo County should take comfort in knowing that we're acting decisively for the good of the public. We cannot allow this virus to overwhelm our healthcare infrastructure. We must flatten that yield curve by taking this action. With that, we're open to any questions that you may have. Yes, ma'am.
Hi, County Judge. So you're saying that there are currently no cases of COVID-19 in Hidalgo County?
That is correct.
So what prompted you to declare the disaster this week?
We have been studying the different areas that have been affected in the past. This is a virus that spreads very quickly. So we want to make sure that we are as prepared as possible to curtail any spreading of this. So we believe this is the most prudent action to take to make sure that we don't overwhelm our public health institutions with too many people. Right now, the uncertainty is that a lot of the people that we have in Hidalgo County haven't been tested. I believe the information that I have, maybe as little as 15 people have been tested. Okay, so that's really not a lot of people. So in order for us to be as careful as we can be, we felt that asking for this 2-week period, the incubation period of this is around 14 days. So we feel that if anybody is affected right now, we're going to find out in 14 days the extent of any of that here in Hidalgo County. We believe that merits this decision. Yes, sir.
The city of Edinburgh today released a Facebook Live that they said 2 people have been tested on the private sector and 2 people were negative. Could you explain the 15 people that were, you said 15 people that were tested. Could you explain if people are in self-quarantine? Because I know Cameron County has said that a few people are in self-quarantine. Sure.
I want to let Mr. Olivares do that, and I don't even know if Mr. Olivares is not. Please come, Eddie. The university, UTRGV, also the medical school, has been testing some of the students. So in addition to the 15 that we know about, I believe there were also around 15 students that were tested at UTRGV. Eddie, would you please answer that question?
So the situation involving testing is a little bit complicated from the perspective in the private sector. is trying to get the numbers from them. It's been a challenge for us. We are working with Quest, LabCorp, and the companies that are providing the testing and asking them to give us the list of physicians that they've given the testing material to. Once we get those lists, we could also follow up with those doctors and ask them, how many have you done? So right now, we're guesstimating there was some testing done at UTRGV, there was some testing done and at a couple of other private physicians here in the McAllen, Edinburgh area. But we're also tracking all the testing being done at the hospital. So there's some pending tests out there. It takes 5 days to get the test results back.
In regards to the quarantine, is there anyone in quarantine that you guys know of?
Quarantine is a legal term, okay? So as far as quarantine, we have none. As far as isolation, there are several people who are in isolation. We've had a lot of people who are travelers and self-isolated. They've reported themselves as having traveled in an area of risk. They're asymptomatic, no symptoms. So there's many people who are asymptomatic and are home isolation.
There's been a lot of talk about ICU beds, ventilators. Is there any idea how well situated Hidalgo County is with those amenities if this breaks out down here?
I didn't hear the question. What was the question?
There's a lot of talk about a lack of ICU beds.
ICU beds.
How do we stand when it comes to those resources?
One of the things involving ICU beds, we're working very closely with all our hospital partners. Hidalgo counties, our hospital system, they're very busy all the time. I mean, our number of beds, activity year-round is very high activity. And right now, with some of the winter tourists still here, there's a lot of high activity. So we're keeping track of all of those. There's a misnomer that if you get sick, remember, 81 to 85% of the people who get COVID are walking ill. Very few of them actually wind up in a hospital that would involve a ventilator. So there's a very low percentage of that. So by what the judge is doing and by what everyone's doing, the goal is to bring that curve down and lessen the impact, and by encouraging our elderly who are impacted the most to stay home and avoid any large groups, it's a good preventative measure.
But I believe and again, please check me on this, but I believe that our number of beds per 1,000 citizens is pretty equal to any other place in the United States.
It is.
So we're no better or worse than
anybody else.
And I was just wondering, how is the county working with the Texas Department of State Health and Services? Because I contacted them earlier, and I was trying to figure out within Region 11 how many people have actually been tested, but they were saying that they don't have those numbers yet. They don't have a breakdown of those numbers. So I was wondering, how is the county working with that, and why isn't there numbers on that?
Eddie?
We're working very closely with Dr. Emily Pro, the Region 11 Medical Director. She oversees 19 counties to include our county within that. The way the state testing system works and state system works, it's difficult for them to get numbers for the private side. The private sector is the one we're having the most complications with in getting numbers from. We know exactly how many have been sent to the state laboratory. She knows how many numbers have gone to the state laboratories, but when she's trying to compile the private sector numbers, that's very difficult because they're having the same trouble we're having in getting those private sector numbers.
Yeah, and don't leave, but here's my understanding, that we have limited test supplies, so we want to use them sparingly when it's appropriate. So just because you have some symptoms doesn't mean that you're going to get tested. You have to really kind of pre-qualify to have the test. Sure. Did I say that correctly?
That's correct. One of the things we're asking all physicians and doctors' offices to do a full respiratory panel on a person who is showing some types of symptoms. That respiratory panel will rule out any other illnesses or concerns. There's been a lot of other illnesses that have been identified that are not COVID-19.
And that's the reason we're taking this action. Just imagine if let's say, and I believe we have more than 200 tests available here. Say that we do get more than that. Now what? So this is why we're taking this action, because we know, based on the experts, that the way that it can spread very fast if to mass gatherings. So that's why we're trying to avoid this mass gatherings of people.
Will the Mercedes Black Sox show officially?
I'm sorry, I'm going to let somebody else, if somebody else has some questions.
Yo les sugiero life break, o sea, ahorita están todos en vivo y quisiéramos, las personas que no hablan inglés, pudiéramos hacer la misma información, los datos básicos en español.
Sí, con mucho gusto, pues si podemos esperar, lo acabamos en inglés. Gracias, Daniel. Okay, go ahead, I'm sorry then.
Yeah, no. Well, the Mercedes, could you formally declare, is it going to be declared officially ended, the Mercedes Livestock Show? Canceled?
Yes. When I sign the order tomorrow, it will officially require the livestock show to stop operations. By definition, they would qualify as more than a 50-person gathering. Yes, ma'am.
Yes, so how important is it to practice the social distancing? Do we encourage all residents to stay home at this point?
You know, absolutely. If you read anything about prevention, that is the best way to prevent this. Is just stay away and have social separation. Absolutely.
Does the county have an idea of how many people in the county might have it? You know, and also when did I guess preparations for this officially begin with the county and preparing for coronavirus?
Well, okay, go ahead and answer that question, but Al.
As far as how many might have it, well, we don't know. Okay, but as far as we started preparing for this well over a month ago, we started working on this and talking about it.
The real empirical evidence that's out there is, I believe the first case in Texas was in January the 21st. So we start with 1. The last information that I have is 56. It's grown some more.
It may have gone up a little bit.
It might be at 60. It might be at 60 already. In China, the infection rate was, if you have 1, you're going to infect 3.3. Then it went down to some other numbers. So really, this action that we're taking is not because something has already happened. We just don't know what the possibility is, and it grows very fast. So we just want to stop it. We want to take a very conservative approach to stopping this disease should it hit us.
Sir, are you working with the other counties, just as at South Padre Island, they have a concert tonight, there's hundreds of kids out there. Any concerns from a regional approach that Cameron County is not?
Yes. In fact, I just spoke about 20 minutes ago with Judge Trevino, and he has already signed. Well, actually, I don't want to preempt anything that he may want to do, but my understanding is yes, that he's going to have some similar declarations very, very soon. And my understanding is that South Padre Island is going to be, the beaches will be closed. But again, I'm sorry, Judge Trevino, if that isn't out there yet.
And are there any binational efforts going on right now with Mexico across them? And if so, what are those conversations like right now?
Go ahead.
The answer is yes. There is a lot of binational efforts. In fact, we currently have in our Emergency Operations Center, we actually have a state representative from the Department of State Health Services who deals with binational issues, and we're in constant contact with our partners in Mexico and the state of Tamaulipas.
What does the plan look like so far with that? Because I think there was 2 reported.
Those cases have been since suspended. They're not actual cases in Tamaulipas.
But how are they working together? What does the plan, an actual plan look like right now?
So we have had a long-term plan at a binational level. It starts with a plan called EWIDS, Early Warning Infectious Disease Surveillance, and it started 12 years ago, where we work with them on not only this type of illness, but any illness. So we're in constant contact with their public health and epidemiologists in Mexico. There's an office in Austin called the Office of Border Health through the Department of State Health Services, and they have weekly and sometimes bi-weekly web conferences, I guess is the easiest way to say it, and report any illnesses they have throughout their country or any immigrating illnesses as well. But we're in contact with our sister health departments in Reynosa several times a week to catch up with each other's numbers.
And do they have testing available right now for them as well, or what does that look like?
You would have to ask some of them. I know the state of Mexico, I know the state of Tamaulipas, the country of Mexico is testing, but you would have to review that with them.
One more question.
Just to make sure we get the numbers right. In terms of testing, 15 people have been tested, and if so, are those the 15 out of the 200 tests or 125 tests that were reported last week? Or is that were sent to the state? Because I know Cameron County has a different situation.
Okay, you want to answer?
Okay, I want to make this real clear. We know of 15 to 20 tests that have been sent. The range is there because we're not getting the private sector numbers. We were told by one company that they have put 160, 170 tests in Hidalgo County with different physicians. They are not giving us that information, who those physicians are. So we cannot call those physicians and ask how many have they used. So the number you're asking for is very difficult to ascertain until we get the cooperation from the physicians that have those tests.
Thank you all.
Well, hold on. And in addition to that, as I told you before, according to the UTRGV Medical School, they are testing some of the students, and I believe they told me that they had tested 15. Okay? We're gonna.
Thank you all. The judge will graciously agree to do some Spanish and other one-on-ones if you all need to on the side. Thank you.